Welcome. We are thrilled that you are joining us for this medical assistant education, and we welcome you to cardiovascular medicine and the ability to help us and share in the care of managing cardiovascular patients. Our goal with this course is to really give you some of the basics around the medical assistant role, some of the skills and competencies that you need for your role. We want to explore with you and expose you to some of the more common cardiology medications, some of the cardiac anatomy and physiology, how to intake a patient, like take a blood pressure or vital signs. And we know some of this you received in your training, but this will be very cardiovascular specific. We're going to walk you through how to prepare a chart to get ready for an upcoming visit. We'll talk to you about how to have a conversation with the patient and use techniques such as teach back. And we'll talk in general just about professionalism and the importance of the role. So again, I want to welcome you to our academy. In addition to that, I wanted to explain to you how important your role is when it comes to the way we care for cardiovascular patients. In many of your practices, you will be the face and the first person that patients see when they come in to see their cardiovascular clinician, and you will likely be the last person they see as they leave their office. Sometimes you will speak to these patients on the phone. And so understanding your role, understanding the value of the role, and being skilled in taking care of these patients is going to be really important to your success and our success in having you in the role. So once again, I congratulate you on not only the position that you're in, but taking the time to go through this course to better understand the work that you'll be doing and how to better manage and take care of these patients. So I want to introduce myself. My name is Ginger Biesbrock. I'm the EVP of Care Transformation with MedAxiom. And in the 9.5 years that I've been with MedAxiom, I have had the opportunity to be in multiple programs across the country. And once again, I can say hands down the value of the role and the value of the role that you're fulfilling within your organization. In addition to that, I'm a PA and I worked clinically in cardiology for a little over a decade. And my relationship with the medical assistants that I worked with was incredibly important. They were some of the most dear and trusted colleagues. I learned from them, they learned from me, and we really learned to have a very good relationship together and how we shared care with the way we took care of these patients. So once again, I'm going to congratulate you in the role. So I had the opportunity to provide a number of the 8 modules that we have put together for you. But in addition to that, I wanted to go ahead and introduce to you our other 2 faculty members. So the first one is Lesley Jones Larson, who comes to us with 22 years of experience in healthcare in both the ambulatory and the acute care settings. She actually comes to us from the Northwest in Portland, Oregon, where she's had the opportunity for the last decade of her life to work in an ambulatory setting, again, working with multiple medical assistants, RNs, APPs, and physicians, and really helping to lead that organization within their ambulatory care for their cardiovascular patients. She is a fellow of the American College of Healthcare Executives and has an educational background with a Master's of Healthcare Administration. She's published on topics, including those in the New England Journal of Medicine Catalyst. In addition to Lesley, we are also joined by Jamie Warren, who is a vice president of Care Transformation, and she has a strong background in diagnostic imaging. Jamie has over 22 years of clinical and operational experience and began her journey in healthcare as a nuclear medicine technologist that evolved into operations leadership, and again has an excellent viewpoint from the clinician to the C-suite when it comes to cardiovascular imaging. Her academic work includes a Doctor of Education and Leadership and Learning with a specialization in Healthcare Administration and Leadership. She also has a Master's of Business Administration and a Bachelor of Health Science in Nuclear Medicine Technology. So I am thrilled to have Jamie and Lesley work with me on this offering, and we are excited to have you involved. You will find at the end of each of the modules a quiz, as well as some additional reading materials. If at any time you have questions related to the materials or the topic, please reach out to your local proctor or your local supervisor. But in addition, you are more than welcome to reach out to us with any questions at academy@medaxiom.com. And again, congratulations on your new role, and we welcome you to the field of cardiovascular medicine.